Or message madadre sir illi barutte. Chat.
Okay. ಶುರು ಮಾಡಬಹುದಾ?
Yes, sir.
Okay, amma.
Yes, sir.
Yes, sir. Do you have any question to ask me?
I think at the end, Professor, so that we can have continuation.
You can ask at the end, amma.
Yeah.
The next topic is general reaction of public to mentally ill persons. ಸಾಧಾರಣವಾಗಿ ಜನರು ವರ್ತಿಸುವ ರೀತಿ, how general public react to the mentally ill persons. The following are emotional reactions. The first one is fear and suspicion that mentally ill person may be harmful. This is first reaction. ಕೆಲವರಿಗೆ ಮೆಂಟಲಿ ಇಲ್ ಪರ್ಸನ್ ನೋಡಿದ್ರೆ ಭಯ ಇರಬಹುದು, ಸ್ವಲ್ಪ ಅನುಮಾನ ಇವರು ಏನ್ ಮಾಡ್ತಾರೆ ಅನ್ನೋದು. The second reaction is disgust and dislike because the mentally ill person is not clean. Third is anger and rejection because the mentally ill person annoys others. Annoys ಅಂದ್ರೆ ಕೋಪ. The fourth one is sympathy and pity. ಕೆಲವರಿಗೆ ಅಯ್ಯೋ ಪಾಪ ಅನ್ನುವುದು. For some it is amusement and laughter. ಕೆಲವರು they don't trust the mentally ill persons. And last one is indifference. These are all general reactions of public to mentally ill persons. Now, the next one is, which is not there in the slide. If a patient comes to a doctor, a psychiatrist, we have mainly four professionals work in the field of mental health. We call them as team members. They are, one is a psychiatrist, the second is clinical psychologist, the third is psychiatric social worker, and the fourth one, psychiatric nurse. These four persons work together with a common goal that is referred to as teamwork. Psychiatrist has a different work to perform. Social worker has a different work to perform. Psychologist has a different work to perform. Nurse has different work to perform. But all four work together. They don't encroach into the domain of other professionals. They work together. So when a patient comes to a professional, how the patient is going to be studied, that I will explain to you. That is what we say, psychiatric history taking. That is, first visit patient baruvaga, complete details of the case are to be taken. Those details are required for making a diagnosis and planning the treatment. In India, we follow ICD classification. ICD classification means International Classification of Diseases. That's the meaning of, that is what the abbreviation stand for. International Classification of Diseases, brought out by WHO periodically. We follow ICD classification everywhere. The purpose of this classification is to have uniform diagnosis. First one. Andre, ee lakshanagalu iddare, avariki ee kaile ee ನಂಬರು ಹೇಳಬೇಕು ಅನ್ನೋದು. ICD classification dalli there are numbers will be there. For each diagnosis a specific number is given. ಆ diagnosis ಕೆಳಗೆ ರೋಗ ಲಕ್ಷಣಗಳು ಹೇಳುವುದು. ಆ ಲಕ್ಷಣಗಳು ಇದ್ದರೆ ನಾವು ಆ diagnosis ಮಾಡಬೇಕು. Many countries in the world follow ICD classification. There is one more classification called as a DSM, Diagnostic and Statistical Manual, another classification. But India, we follow ICD classification. The purpose of ICD classification is to know how big the problem is. ಎಲ್ಲರೂ ಒಂದೇ ರೀತಿಯಲ್ಲಿ ಡಯಾಗ್ನೋಸಿಸ್ ಮಾಡುವುದು. This is the first advantage. Cultural variations may be there, but still you follow that classification and make the diagnosis, so that we will be knowing exactly how many cases are there in a particular locality, in a particular country. Like this, in all countries, we have the statistics, and finally we say how many cases are there in the world. So we follow ICD classification. Not only for mental health, for many other disorders or diseases, we follow ICD classification. Now, when a patient comes along with a family member, how do you examine? How a psychiatrist examines, or how a social worker examines, or how a psychologist examines first day, first time visit. First time visit varuvaga, we call the patient along with the family member inside. We get details from them. Certain details we get it from the family members. Yenu details andre patient's problem. That's what we say. What are the presenting complaints? Iga avarige yenu samasye ide? That's what we say, presenting complaints. In the detailed case file, we make a mention there who is giving information. Is the patient himself is giving the information? In case of certain minor mental disorders, the patient himself may give the information. Certain major mental disorders, the family members give the information. Mostly the father or mother. So who gives the information? Mother. Is it reliable? Yes, reliable. So we want an important person to accompany the patient. When I say important person, means the family member. A married person, important person is the spouse. A child means a parent, not somebody else. They give information. That's called as presenting complaints. One example I give, presenting complaints means they say, my son is not eating for the last 4 days. So 4 ದಿವಸದಿಂದ ಸರಿಯಾಗಿ ಊಟ ಮಾಡ್ತಾ ಇಲ್ಲ. ಫಸ್ಟ್ ಕಂಪ್ಲೇಂಟ್. 4 ದಿವಸ. 3 ದಿವಸದಿಂದ ಸರಿಯಾಗಿ ನಿದ್ರೆ ಮಾಡ್ತಾ ಇಲ್ಲ. ಸೆಕೆಂಡ್ ಕಂಪ್ಲೇಂಟ್. ಥರ್ಡ್ ಕಂಪ್ಲೇಂಟ್ ಎಲ್ಲರನ್ನೀ ಬೈಯೋದು. 3ನೇ ಕಂಪ್ಲೇಂಟ್ ಫಾರ್ ದ ಲಾಸ್ಟ್ 2 days. ಇವತ್ತು ಬೆಳಗ್ಗೆಯಿಂದ ಎಲ್ಲರನ್ನೀ ಹೊಡೆಯೋದು. ಇದು 1 ದಿವಸದಿಂದ. Based on the duration, you write the symptoms. ಇವರ ಕಾಯಿಲೆ ಜಾಸ್ತಿ ಸಮಯ ಇರುವುದು ಫಸ್ಟ್ ಬರುವುದು, ಆಮೇಲೆ ಕ್ರಮಬದ್ಧವಾಗಿ ಬರೆಯಬೇಕು. This is called as presenting complaints. ನೆಕ್ಸ್ಟ್, ಈ ಕಾಯಿಲೆ, ಈ ಕಂಪ್ಲೇಂಟ್ಸ್ ಎಲ್ಲ ಸಡನ್ ಆಗಿ ಬಂತ, ಇನ್ಸಿಡಿಯಸ್ ಅಂದ್ರೆ ಒಂದೇ ಕ್ಷಣದಲ್ಲಿ ಬಂದಿಲ್ಲ, ಬಟ್ ಯಾವಾಗ ಬಂತು ಅನ್ನೋದು ಎಕ್ಸಾಕ್ಟ್ಲಿ ಹೇಳೋದಕ್ಕೆ ಆಗೋದಿಲ್ಲ, ನಿಧಾನವಾಗಿ ಬಂತು ಅನ್ನೋ ಅರ್ಥ. I repeat again, sudden onset. Sudden onset ಅಂದ್ರೆ ದಿಢೀರ್ನ ಏನಾಗಿದೆಯೋ ಗೊತ್ತಿಲ್ಲ ಸರ್, ನಿನ್ನ ನೈಟ್ ಎಲ್ಲ ಆರಾಮ ಮಲ್ಕೊಂಡೆ, ಬೆಳಗ್ಗೆ ಎದ್ದಿದ ತಕ್ಷಣ he started shouting. He was talking to self, shouting. This is what we say, sudden ಆಗಿ ಬಂತು. ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಳಿ, ಸಡನ್ ಆಗಿ ಬಂತು ಅಂದ್ರೆ ಟ್ರೀಟ್ಮೆಂಟ್ ವಿಲ್ ಬಿ ಈಸಿ. ನಿಧಾನವಾಗಿ ಬಂತು ಸರ್, ಮೈ ಸನ್ ಇಸ್ ಟೇಕಿಂಗ್ ಆಲ್ಕೋಹಾಲ್. ಯಾವಾಗಿಂದ ಎಕ್ಸಾಕ್ಟ್ಲಿ ಗೊತ್ತಿಲ್ಲ ಸರ್, 4-5 ವರ್ಷದಿಂದ ಇದೆ. ದಿಸ್ ಈಸ್ ಎಕ್ಸಾಕ್ಟ್ಲಿ ವಿ ಡೋಂಟ್ ನೋ ವೆನ್ ಇಟ್ ವಾಸ್ ಸ್ಟಾರ್ಟೆಡ್. ಸೊ ಕಂಪ್ಲೇಂಟ್ಸ್ ಎಲ್ಲ ವಿ ಟೇಕ್ ಇಟ್ ಫ್ರಮ್ ದ ಫ್ಯಾಮಿಲಿ ಮೆಂಬರ್ಸ್. ಅದರ ಜೊತೆಗೆ ವಿ ಆಲ್ಸೋ ಗೆಟ್ ಪರ್ಸನಲ್ ಇನ್ಫಾರ್ಮೇಶನ್ ಅಬೌಟ್ ದ ಪೇಷಂಟ್. ಪೇಷಂಟ್ ಚಿಕ್ಕ ವಯಸ್ಸಿಂದ ಎಲ್ಲ ಇನ್ಫಾರ್ಮೇಶನು. ಚಿಕ್ಕ ವಯಸ್ಸು, ಹುಟ್ಟಿದ್ದರಿಂದ ಸ್ಕೂಲಿಗೆ ಹೋಗುವುದು, ಆಮೇಲೆ ಫ್ರೆಂಡ್ಸು, ಆಮೇಲೆ ಮದುವೆ ಆಗಿದ್ರೆ ಅರೇಂಜ್ಡ್ ಮ್ಯಾರೇಜಾ ಆರ್ ಲವ್ ಮ್ಯಾರೇಜಾ ಆರ್ ಬೇರೆ ಮ್ಯಾರೇಜಾ, ಹೌ ಆರ್ ದ ಕಪಲ್ ನೌ, ಆರ್ ದೇ ಹ್ಯಾಪಿ ನೌ, ಮ್ಯಾರಿಟಲ್ ಲೈಫ್ ಚೆನ್ನಾಗಿದೆಯಾ, ಮಕ್ಕಳಿದರ ಅನ್ನುವುದು ಎಲ್ಲಾನು ಒಂದು ಕ್ರಮಬದ್ಧವಾಗಿ ಬರೆಯುವುದು. ಕೆಲಸ ಮಾಡ್ತಾ ಇದ್ರ ಅನ್ನೋದು ಇಂದ್ರೆ ಅದರ ಬಗ್ಗೆ ಬರೆಯೋದು. ಸೊ all information about the client, about the patient. This information generally we get it from the family members. Family members ಹೇಳುವುದು, ಕಂಪ್ಲೇಂಟ್ಸು ಅವರೇ ಹೇಳುವುದು, ಫ್ಯಾಮಿಲಿ ಡೀಟೇಲ್ಸು ಅವರೇ ಹೇಳುವುದು, ಮ್ಯಾರೇಜ್ ಡೀಟೇಲ್ಸು ಅವರು ಹೇಳುವುದು, ಚಿಕ್ಕ ವಯಸ್ಸಿಂದ ಏನಾಗಿದೆ ಅನ್ನೋದು ಎಲ್ಲ ತಾಯಿ ಹೇಳುವುದು. ಅವಶ್ಯಕತೆ ಇದ್ರೆ ಇನ್ನೂ ಡೀಟೇಲ್ಸ್ ಅದರ ಬಗ್ಗೆ ನಾವು ತಿಳ್ಕೋಬೇಕು. ಅಂದರೆ ಡಯಾಗ್ನೋಸಿಸ್ ಇರಬಹುದು ಅನ್ನೋದು ಯೋಚನೆ ಮಾಡಿ ಆ ವಿಷಯದ ಬಗ್ಗೆ ಜಾಸ್ತಿ ಮಾಹಿತಿ ಸಂಗ್ರಹಣೆ ಮಾಡಬೇಕು. ಸೊ ಚೈಲ್ಡ್ಹುಡ್, ಸ್ಕೂಲಿಂಗು, ಆಮೇಲೆ ಕಾಲೇಜ್ ಎಜುಕೇಶನು, ಆಮೇಲೆ ಎಂಪ್ಲಾಯ್ಮೆಂಟು, ಆಮೇಲೆ ಮ್ಯಾರಿಟಲ್, ಆಮೇಲೆ ಮಕ್ಕಳು, ಆಮೇಲೆ ಎಂಪ್ಲಾಯ್ಮೆಂಟು. ದಿಸ್ ಇಸ್ ಹೌ ವಿ ಹ್ಯಾವ್ ರೈಟ್ ಇನ್ ಎ ಕ್ರೊನಲಾಜಿಕ್ ಇನ್ ಆರ್ಡರ್ಲಿ ವೇ. ಅದಾದ ಮೇಲೆ ವಿ ರೈಟ್ ಹಿಸ್ ಪ್ರೀಮಾರ್ಬಿಡ್ ಪರ್ಸನಾಲಿಟಿ. ಪ್ರೀಮಾರ್ಬಿಡ್ ಪರ್ಸನಾಲಿಟಿ ಅಂದರೆ ಪ್ರೀ ಅಂದರೆ ಮುಂಚೆ, ಮಾರ್ಬಿಡ್ ಅಂದರೆ ಕಾಯಿಲೆ. ಕಾಯಿಲೆ ಬರುವುದಕ್ಕೆ ಮುಂಚೆ ಅವನ ವ್ಯಕ್ತಿತ್ವ ಈ ರೀತಿಯಲ್ಲಿ ಇದೆ ಅನ್ನುವುದು. ಕಾಯಿಲೆ ಬರುವುದಕ್ಕೆ ಮುಂಚೆ ಅವನ ವ್ಯಕ್ತಿತ್ವ ಅಂದ್ರೆ ಅರ್ಥ ಏನು ಅಂದ್ರೆ, ಫ್ಯಾಮಿಲಿ ಮೆಂಬರ್ಸ್ ಏನು ಹೇಳ್ತಾರೆ ಅಂದ್ರೆ, ಸರ್ 1 month ಇಂದ ಈ ಸಮಸ್ಯೆ ಇದೆ. ನಾವು ಕೇಳೋ ಕ್ವಶನ್, 1 monthಗೆ ಮುಂಚೆ ಏನು ಸರ್? ಮುಂಚೆ ತುಂಬಾ ಆರಾಮಾಗಿದ್ದಾರೆ ಸರ್, ಸಮಸ್ಯೆನೂ ಇಲ್ಲ. ದಟ್ ಈಸ್ ವಾಟ್ ವಿ ಸೇ ಪ್ರೀಮಾರ್ಬಿಡ್ ಪರ್ಸನಾಲಿಟಿ. 1 monthಗೆ ಮುಂಚೆ ಅವನ ವ್ಯಕ್ತಿತ್ವ ಈ ವಿಷಯದಲ್ಲಿ ಮನೆ ಜವಾಬ್ದಾರಿ ತಗೊಳ್ಳೋದು, ಕೆಲಸ ಮಾಡುವುದು, ಊಟ ಮಾಡುವುದು, ನಿದ್ರೆ ಮಾಡುವುದು ಮತ್ತು ಮೂಡು ಎಲ್ಲ ವಿಷಯಗಳು ನಾವು ತಿಳ್ಕೋಬೇಕು ಕಾಯಿಲೆ ಬರುವುದಕ್ಕೆ ಮುಂಚೆ. ಪ್ರೀಮಾರ್ಬಿಡ್ ಪರ್ಸನಾಲಿಟಿ. ಇಷ್ಟು ಆದ ಮೇಲೆ ನೆಕ್ಸ್ಟ್ ಒನ್ ಇಂಪಾರ್ಟೆಂಟ್ ಥಿಂಗ್ ವಿಲ್ ಬಿ ದೇರ್, ದಟ್ ಈಸ್ ಅಬೌಟ್ ಮೆಂಟಲ್ ಸ್ಟ್ಯಾಟಸ್ ಎಕ್ಸಾಮಿನೇಷನ್ ಅಂತೀವಿ. ಮೆಂಟಲ್ ಸ್ಟ್ಯಾಟಸ್ ಎಕ್ಸಾಮಿನೇಷನ್ ಅಂದ್ರೆ it is a structured way of observing and describing a patient's state of mind at the time of interview. ನೀವು ಅವರ ಜೊತೆಗೆ ಮಾತನಾಡುವಾಗ, ಒಬ್ಬ ಡಾಕ್ಟರ್ ಪೇಷಂಟ್ ಜೊತೆಗೆ ಮಾತನಾಡುವಾಗ ಆ ಸಮಯದಲ್ಲಿ ಅವನ ಮಾನಸಿಕ ಸ್ಥಿತಿ ಈ ರೀತಿಯಲ್ಲಿ ಇದೆ ಅನ್ನುವುದು. This is called as mental state examination or mental status examination antivi. This is important for making diagnosis. ಅವರ ಸಮಸ್ಯೆ ತಿಳ್ಕೊಳ್ಳುವುದಕ್ಕೆ ಅತಿ ಮುಖ್ಯವಾದದ್ದು. ಈ ಟೆಸ್ಟ್ ನಾವು ಪೇಷಂಟ್ ಮೇಲೇನೆ ಮಾಡಬೇಕು. ಯಾಕಂದ್ರೆ ಪೇಷಂಟು ಸ್ಟೇಟ್ ಆಫ್ ಮೈಂಡ್ ನಾವು ಅರ್ಥ ಮಾಡಿಕೊಳ್ತಾ ಇದ್ದೀವಿ. ಏನು ಮಾಡಬೇಕು? ಪ್ರಶ್ನೆಗಳು ಕೇಳುವುದು, ಉತ್ತರ ಪಡೆಯುವುದು, ಅದರ ಜೊತೆಗೆ ಅವನು ಅಬ್ಸರ್ವ್ ಮಾಡುವುದು. ನೇರವಾಗಿ ಪ್ರಶ್ನೆಗಳು ಕೇಳುವುದು, ಅವನಿಗೆ ಅಬ್ಸರ್ವ್ ಮಾಡುವುದು ಎಲ್ಲ ನಾವು ಮಾಡಬೇಕು. ವೆರಿ ವೆರಿ ಸ್ಕಿಲ್ಫುಲ್ ಎಕ್ಸರ್ಸೈಸ್ ಈಸ್ ಮೆಂಟಲ್ ಸ್ಟ್ಯಾಟಸ್ ಎಕ್ಸಾಮಿನೇಷನ್. ದಿಸ್ ಇಸ್ ಪಾರ್ಟ್ ಬಿ. ಇಲ್ಲಿವರೆಗೂ ಹೇಳುವುದು ಪಾರ್ಟ್ 1. ಪ್ರೀಮಾರ್ಬಿಡ್ ಪರ್ಸನಾಲಿಟಿ ಆದ ಮೇಲೆ ಡೀಟೇಲ್ಸ್ ಅಬೌಟ್ ದ ಪ್ರೆಸೆಂಟ್ ಇಲ್ನೆಸ್. ಈಗ ಅವನಿಗಿರುವ ಪ್ರತಿಯೊಂದು ಲಕ್ಷಣವೂ ಡೀಟೇಲ್ಡ್ ಆಗಿ ಬರೆಯಬೇಕು. 5 ದಿವಸದಿಂದ ನಿದ್ರೆ ಮಾಡ್ತಾ ಇಲ್ಲ ಅಂದ್ರೆ ಏನು? ನಿದ್ರೆ ಮಾಡ್ತಾ ಇಲ್ಲ ಅಂದ್ರೆ ನಿದ್ರೆಗೆ ಹೋಗ್ತಾರಾ? ಹೋಗಿ ನಿದ್ರೆ ಬರುವುದಿಲ್ವಾ? ಆರ್ ಹಿ ವಿಲ್ ನಾಟ್ ಗೋ ಟು ಬೆಡ್ ಎಟ್ ಆಲ್ ಅನ್ನುವುದು. ಪ್ರತಿಯೊಂದು ಊಟ ಮಾಡುವುದಿಲ್ಲ ಅಂದ್ರೆ ಏನು ಅರ್ಥ? ಪ್ರತಿಯೊಂದು ಲಕ್ಷಣ ನಾವು ಏನು ಹೇಳಿದೆವೋ ಸೈನ್ಸ್ ಅಂಡ್ ಸಿಂಪ್ಟಮ್ಸ್ ಫಸ್ಟ್, ಅದಕ್ಕೆ ನಾವು ಸಂಪೂರ್ಣವಾದ ವಿವರಗಳು ಹೇಳಬೇಕು. ದಟ್ ಈಸ್ ಕಾಲ್ಡ್ ಎಸ್ ಪ್ರೆಸೆಂಟ್ ಇಲ್ನೆಸ್ ಬಗ್ಗೆ ಡೀಟೇಲ್ಸ್. ಅದಾದ ಮೇಲೆ ಮೆಂಟಲ್ ಸ್ಟ್ಯಾಟಸ್ ಎಕ್ಸಾಮಿನೇಷನು. ಈ ಮೆಂಟಲ್ ಸ್ಟ್ಯಾಟಸ್ ಎಕ್ಸಾಮಿನೇಷನ್ದಲ್ಲಿ ಫಸ್ಟ್ ಒನ್ ವಿಲ್ ಬಿ ಅವರ್ ಅಬ್ಸರ್ವೇಷನ್. ಏನು ಅಬ್ಸರ್ವೇಷನ್ ಅಂದ್ರೆ ಹಿಸ್ ಅಪಿಯರೆನ್ಸ್ ಈ ರೀತಿಯಲ್ಲಿ ಇದೆ ನೋಡುವುದಕ್ಕೆ. ಮಾತನಾಡುವುದು, ಐ ಕಾಂಟ್ಯಾಕ್ಟು, ನಡ್ಕೊಂಡು ಬರುವ ರೀತಿ, ಕೂತ್ಕೊಂಡು ಬಡಿಯುವ ರೀತಿ, ಅವನು ಡ್ರೆಸ್ ಪ್ಯಾಟ್ರನ್ನು ಎಲ್ಲ ನಾವು ವೀಕ್ಷಿಸಬೇಕು, ಅವಲೋಕನ ಮಾಡಬೇಕು. ದಟ್ಸ್ ವಾಟ್ ವಿ ಸೇ ಅಬ್ಸರ್ವೇಷನ್. ಅದಾದ ಮೇಲೆ ಅವನ ವಾಯಸ್ಸು, ಅವನ ಸ್ಪೀಚಿಂಗ್, ಅವನ ಲ್ಯಾಂಗ್ವೇಜ್. ಅದಾದ ಮೇಲೆ ಅವನ ಮೂಡ್ ಈಸ್ ಇನ್ ಆಂಗ್ರಿ ಮೂಡ್, ಡಿಪ್ರೆಸಿವ್ ಮೂಡ್, ಯೂಫೋರಿಕ್ ಮೂಡ್. ನಾವು ಎರಡು ವಿಷಯವಾಗಿ ಕೇಳ್ತೀವಿ. ಒಂದು, ಹೌ ಆರ್ ಯು ರೈಟ್ ನೌ? ಈ ಮೇ ಸೇ ದಟ್ ಐ ಆಮ್ ವೆರಿ ಹ್ಯಾಪಿ. ಹೇಳುವುದು ಹ್ಯಾಪಿ, ಬಟ್ ಮುಖದಲ್ಲಿರುವ ಭಾವನೆಗಳು ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕು. ಹೇಳುವುದು ಸಬ್ಜೆಕ್ಟಿವ್ ಮೂಡು, ಮುಖದಲ್ಲಿರುವ ಭಾವನೆಗಳು ನೋಡುವುದು ಆಬ್ಜೆಕ್ಟಿವ್ ಮೂಡ್. ಸೊ ಮುಖ ಹೇಳುವುದು ಒಂದು, ಯುವರ್ ಟಂಗ್ ಮೇ ಟೆಲ್ ಲೈಸ್ ಬಟ್ ನಾಟ್ ದ ಫೇಸ್ ಅನ್ ಅರ್ಥ. ಮೂಡ್ ಈ ರೀತಿಯಲ್ಲಿ. ಮೂಡ್ ಆದ ಮೇಲೆ ಕಾಗ್ನಿಷನ್, ಅದರಲ್ಲಿ ಮುಖ್ಯವಾಗಿ ಓರಿಯೆಂಟೇಷನ್. ಈ ಓರಿಯೆಂಟೇಷನ್ ನಲ್ಲಿ ಪೇಷಂಟ್ ನಾವು ಕೇಳ್ತೀವಿ, ನಿಮಗೆ ಎಲ್ಲಿದೆಯೋ ಗೊತ್ತಪ್ಪ ಈಗ? ಎಸ್, ಐ ಆಮ್ ದೇರ್ ಇನ್ ಮೆಂಟಲ್ ಹಾಸ್ಪಿಟಲ್. ದಟ್ಸ್ ಕಾಲ್ಡ್ ಎಸ್ ಓರಿಯೆಂಟೆಡ್ ಟು ಪ್ಲೇಸ್. ಈಗ ಟೈಮ್ ಎಷ್ಟಿದೆಯೋ ಆಯ್ತೋ ಗೊತ್ತಾ? ಸುಮಾರಾಗಿ 4 ಗಂಟೆ ಆಗಿರಬಹುದು. ಕರೆಕ್ಟ್, ಸುಮಾರಾಗಿ ಸಾಕು. ಡು ಯು ನೋ ಹೂ ದ ಅದರ್ ಪರ್ಸನ್ ಈಸ್? ನೀವು ಅಕ್ಕಪಕ್ಕದಲ್ಲಿ ಇದ್ದೀರಾ, ಯಾರೋ ಗೊತ್ತಾ? ಎಸ್, ಗೊತ್ತು. ದಿಸ್ ಕಾಲ್ಡ್ ಎಸ್ ಓರಿಯೆಂಟೇಷನ್. ಇದು ನಾವು ಯಾಕೆ ಕೇಳಬೇಕು ಅಂದ್ರೆ, ಇಫ್ ದೇರ್ ಈಸ್ ಎನಿ ಪ್ರಾಬ್ಲಮ್ ರಿಲೇಟೆಡ್ ಟು ಬ್ರೈನ್ ಇಂಜುರಿ ಇರಬಹುದು, ಬ್ರೈನ್ ಟ್ಯೂಮರ್ ಇರಬಹುದು, ಈ ರೀತಿಯಲ್ಲಿರೋ ಪ್ರಾಬ್ಲಮ್ ಇರುವ ವ್ಯಕ್ತಿಗಳಿಗೆ ಈ ಓರಿಯೆಂಟೇಷನ್ ಸ್ವಲ್ಪ ವಿಲ್ ಬಿ ರಾಂಗ್ ಇರಬಹುದು. ಅದು ನಾವು ನೋಡ್ಕೋಬೇಕು. ನೆಕ್ಸ್ಟ್, ಮೆಮೊರಿ. ಹಳೆ ಕಾಲದಲ್ಲಿ ಏನಾಗಿದೆ? ಡು ಯು ನೋ, ನೀವು SLC ಯಾವಾಗ ಪಾಸ್ ಆಗಿದಿರೋ ಗೊತ್ತಾ? ಸಾಧಾರಣವಾಗಿ ನಾವು SLC ಪಾಸ್ ಆಗುವ ವರ್ಷ ನಮ್ಗೆ ಗೊತ್ತಾಗುತ್ತೆ. ನಾವು ಮೆಮೊರಿದಲ್ಲಿ ಇಟ್ಕೊಳ್ತೀವಿ. ಥಿಂಗ್ಸ್ ವಿಚ್ ಹ್ಯಾಪನ್ ಲಾಂಗ್ ಬ್ಯಾಕ್, ಇಟ್ಸ್ ಕಾಲ್ಡ್ ಆಸ್ ರಿಮೋಟ್ ಮೆಮೊರಿ. ಆಸ್ಕ್ ಕ್ವಶನ್ಸ್ ಟು ಫೈಂಡ್ ಔಟ್ ವೆದರ್ ರಿಮೋಟ್ ಮೆಮೊರಿ ಇಸ್ ಗುಡ್. ಎಸ್, ರಿಮೋಟ್ ಮೆಮೊರಿ ಗುಡ್. ರಿಮೋಟ್ ಅಂದ್ರೆ ಯಾವಾಗೋ ಆಗಿತ್ತು. ರೀಸೆಂಟ್ ಮೆಮೊರಿ ಮೀನ್ಸ್ ಥಿಂಗ್ಸ್ ವಿಚ್ ಹ್ಯಾಪನ್ಡ್ ದಿಸ್ ಮಾರ್ನಿಂಗ್. What breakfast you had this morning? Recent memory. Immediate memory means things which happened 2 minutes back or 1 minute back, or just now I gave one exercise, I asked him to repeat it. This is called as immediate memory. So memory test ಮಾಡಬೇಕು. Next, attention and concentration ಎರಡು ಟೆಸ್ಟ್ ಮಾಡಬೇಕು. ಅದರ ಜೊತೆಗೆ ಪರ್ಸೆಪ್ಷನ್ ಅಂದ್ರೆ ಮುಖ್ಯವಾಗಿ ಹ್ಯಾಲ್ಯೂಸಿನೇಷನ್ಸ್ ಬಗ್ಗೆ ನಾವು ತಿಳ್ಕೋಬೇಕು. ಪರ್ಸೆಪ್ಷನ್ ಅಂದ್ರೆ ಕನ್ನಡದಲ್ಲಿ ಪರ್ಸೆಪ್ಷನ್ ಗ್ರಹಿಸುವುದು, ಗ್ರಹಿಕೆ. ಪರ್ಸೆಪ್ಷನ್ ನಾವು ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕು. ಏನು ಅಂದ್ರೆ, ಹ್ಯಾಲ್ಯೂಸಿನೇಷನ್ ಅಂದ್ರೆ ಪರ್ಸೆಪ್ಷನ್ ಇನ್ ದ ಆಬ್ಸೆನ್ಸ್ ಆಫ್ ಸ್ಟಿಮ್ಯುಲಸ್. ಅಲ್ಲಿ ಸ್ಟಿಮ್ಯುಲಸ್ ಏನೂ ಇಲ್ಲ, ಆದರೂ ನನಗೆ ಕಾಣ್ತಾ ಇದೆ. ದಟ್ಸ್ ಕಾಲ್ಡ್ ಆಸ್ ಹ್ಯಾಲ್ಯೂಸಿನೇಷನ್. ಅಲ್ಲಿ ಆನೆ ಇಲ್ಲ, ಬಟ್ ನನಗೆ ಆನೆ ಕಾಣ್ತಾ ಇದೆ ಅಂತ ಹೇಳಿದರೆ ದಟ್ ಬಿಕಮ್ಸ್ ಎ ಫಾಲ್ಸ್ ಪರ್ಸೆಪ್ಷನ್. ಅಲ್ಲಿ ಆನೆ ಇಲ್ಲ, ಬಟ್ ಸ್ಟಿಲ್ ಐ ಆಮ್ ಏಬಲ್ ಟು ಸಿ. ದಿಸ್ ಇಸ್ ಕಾಲ್ಡ್ ಆಸ್ ವಿಜುವಲ್ ಹ್ಯಾಲ್ಯೂಸಿನೇಷನ್. ಸಂಬಡಿ ಟಾಕಿಂಗ್ ಟು ಮೀ, ದೇವರು ನನ್ನ ಜೊತೆಗೆ ಮಾತನಾಡುವುದು. ಏನು ಮಾತಾಡ್ತಾ ಇದ್ದಾರೆ ಅವರು? ದಟ್ ಈಸ್ ಕಾಲ್ಡ್ ಎಸ್ ಆಡಿಟರಿ ಹ್ಯಾಲ್ಯೂಸಿನೇಷನ್. ಸಮ್ ವಾಯ್ಸಸ್, ಯಾರೋ ಹೇಳುವುದು, ಏನೋ ಒಂದು ವಾಯ್ಸು, ಅದು ಏನು, ಯಾರು ಹೇಳಿದ್ದು, ಏನು ಹೇಳ್ತಾ ಇದ್ದಾರೆ ಅವರು ಅಂತ. ಸೊ ವಿಜುವಲ್ ಅಂಡ್ ಆಡಿಟರಿ ಹ್ಯಾಲ್ಯೂಸಿನೇಷನ್ಸ್ ಬಗ್ಗೆ ನಾವು ತಿಳ್ಕೋಬೇಕು ಮುಖ್ಯವಾಗಿ. ಈ ಹ್ಯಾಲ್ಯೂಸಿನೇಷನ್ಸ್ ಅಂದ್ರೆ ಆಲ್ ಆರ್ ಕನ್ಸರ್ನ್ ವಿತ್ ಅವರ್ ಜ್ಞಾನೇಂದ್ರಿಯಗಳು, ಸೆನ್ಸರಿ ಆರ್ಗನ್ಸ್. We have 5 sensory organs. We see, we hear, we feel, feeling is through skin, we taste, and we smell. ಈ 5 hallucinations are of 5 types. ಒಂದು visual hallucination, auditory hallucination, but ಆಡಿಟರಿ ಹ್ಯಾಲ್ಯೂಸಿನೇಷನ್ ತುಂಬಾ ಜಾಸ್ತಿ ನಿಮಗೆ ಕಾಣುವುದು. ವಿಜುವಲ್ ಹ್ಯಾಲ್ಯೂಸಿನೇಷನ್, ಟ್ಯಾಕ್ಟೈಲ್ ಹ್ಯಾಲ್ಯೂಸಿನೇಷನ್, ಆಲ್ಫ್ಯಾಕ್ಟರಿ ಹ್ಯಾಲ್ಯೂಸಿನೇಷನ್ಸ್ ಅಂಡ್ ಜಸ್ಟೇಟರಿ ಹ್ಯಾಲ್ಯೂಸಿನೇಷನ್ಸ್. ಇವು ನಾವು ಪ್ರಶ್ನೆಗಳು ಕೇಳಿ ತಿಳ್ಕೋಬೇಕು, ಅದರ ಬಗ್ಗೆ ಮಾಹಿತಿ ಪಡೆಯಬೇಕು. ನೆಕ್ಸ್ಟ್, ಥಾಟ್, ಅವರ ಯೋಚನೆ ಬಗ್ಗೆ. ಈಸ್ ದೇರ್ ಎನಿ ಡಿಲ್ಯೂಷನ್? DELUSION. ಡಿಲ್ಯೂಷನ್ ಅಂದರೆ ಒಂದು ಅಪನಂಬಿಕೆ. ಡಿಲ್ಯೂಷನ್ ಈಸ್ ಎ ಫಾಲ್ಸ್ ಬಿಲೀಫ್. ಫಾಲ್ಸ್ ಬಿಲೀಫ್ ಅಂದರೆ ಅಪನಂಬಿಕೆ. ಎ ಬಿಲೀಫ್ ವಿಚ್ ಈಸ್ ನಾಟ್ ಟ್ರೂ ಅಷ್ಟೇ ಅಲ್ಲ, ಎ ಬಿಲೀಫ್ ವಿಚ್ ಈಸ್ ನಾಟ್ ಇನ್ ಅಕಾರ್ಡೆನ್ಸ್ ವಿತ್ ಅವರ್ ಕಸ್ಟಮ್ಸ್ ಅಂಡ್ ಟ್ರೆಡಿಷನ್ಸ್. ಈ ಅಪನಂಬಿಕೆ ನಮ್ಮ ಆಚಾರ ವ್ಯವಹಾರ ಸಂಪ್ರದಾಯಗಳಿಗೆ ವಿರುದ್ಧವಾಗಿದ್ದರೆ ನೆಕ್ಸ್ಟ್ ಇನ್ನೊಂದು ಪಾಯಿಂಟ್ ಇದೆ, ವೆರಿ ಡಿಫಿಕಲ್ಟ್ ಟು ಕನ್ವಿನ್ಸ್ ದ ಇಂಡಿವಿಜುವಲ್. ಒನ್ ಪರ್ಸನ್ ಸೇಸ್ ಪೀಪಲ್ ಆರ್ ಫಾಲೋಯಿಂಗ್ ಮೀ, ನಾನು ಎಲ್ಲಿಗೆ ಹೋಗಿದರೂ ಜನ ನನ್ನ ಹಿಂಬಾಲಿಸುವುದು. ಪೀಪಲ್ ಆರ್ ಆಫ್ಟರ್ ಮೀ, ದೇ ಆರ್ ಪ್ಲಾನಿಂಗ್ ಟು ಹಾರ್ಮ್ ಮೀ ಅಂತ ಹೇಳಿದರೆ, ಯಾರು ಪ್ಲಾನ್ ಮಾಡ್ತಾ ಇದ್ರು, ಅವರು ಏನು ಹಾರ್ಮ್ ಮಾಡ್ತಾ ಇದ್ರು ಅನ್ನೋದು. ಬಟ್ ಆಕ್ಚುಲಿ ಯಾರು ಫಾಲೋ ಮಾಡ್ತಾ ಇಲ್ಲ, ಯಾರು ಹಾರ್ಮ್ ಮಾಡ್ತಾ ಇಲ್ಲ. ದಿಸ್ ಈಸ್ ಕಾಲ್ಡ್ ಆಸ್ ಎ ಡಿಲ್ಯೂಷನ್, ಎ ಫಾಲ್ಸ್ ಬಿಲೀಫ್ which is not true, which is not in accordance with your culture, traditions. Next one is, which is very difficult to convince the individual. Whatever evidence you show, whatever logical explanation you give, ಆ ಅಪನಂಬಿಕೆ ಅವರನ್ನು ಬಿಟ್ಟು ಹೋಗುವುದೇ ಇಲ್ಲ. This is what we say an unshakable belief. An unshakable belief. You cannot convince him, even if you educate him, even if you give information to him, even if you give logical explanation, even if you show evidence also, they will not listen. They will not agree. This is called as delusion. Anidre ನಾವು ಸ್ವಲ್ಪ ತಿಳ್ಕೋಬೇಕು ಏನು ಡಿಲ್ಯೂಷನ್ಸ್ ಇದೆಯಾ ಅನ್ನೋದು. Then behavior. How is his behavior? Is he cooperative? Next, insight. Insight ಅಂದ್ರೆ, ಡಸ್ ಹಿ ನೋ ದಟ್ ಹಿ ಹ್ಯಾಸ್ ಎ ಪ್ರಾಬ್ಲಮ್? ನಾನು ಯಾಕೆ ಇಲ್ಲಿಗೆ ಬಂದೆ? ನೀವು ಯಾಕೆ ಬಂದ್ರಿ ಸ್ವಾಮಿ ಇಲ್ಲಿ? ಇದ್ರೆ ಎನಿ ಪ್ರಾಬ್ಲಮ್? If the patient says, I have some problem, I don't know exactly what problem it is, but I have come here for help. Insight partially present ಅಂತ ಅರ್ಥ. ಕೆಲವರು ಸೈಕೋಟಿಕ್ಸ್ ಏನ್ ಮಾಡ್ತಾರಂದ್ರೆ, ಸ್ಕಿಜೋಫ್ರೆನಿಕ್ ಬೇರೆಯವರು, ನಾನು ಇಲ್ಲಿಗೆ ಬರಲಿಲ್ಲ ಸರ್, ಇವರೆಲ್ಲ ಕರ್ಕೊಂಡು ಬಂದರು, ಬಲವಂತವಾಗಿ ಕರ್ಕೊಂಡು ಬಂದರು, ನನಗೇನು ಆಗೇ ಇಲ್ಲ. ದಿಸ್ ಇಸ್ ಕಾಲ್ಡ್ ಎಸ್ ಇನ್ಸೈಟ್ ಆಬ್ಸೆಂಟ್. ಲಾಸ್ಟ್ ಒನ್ ಈಸ್ ಜಡ್ಜ್ಮೆಂಟ್. Judgment means we assess the patient's capacity to make appropriate decisions. We give one example. ನೀವೇನು ಮಾಡ್ತೀರಿ ಈ ಸಂದರ್ಭದಲ್ಲಿ? Will you take a right decision? That's what we say judgment power. ಈ ಎಲ್ಲ ಆದ ಮೇಲೆ based on this information, we make a diagnosis. ಇದು ನಾವು ಮೆಂಟಲ್ ಸ್ಟ್ಯಾಟಸ್ ಎಕ್ಸಾಮಿನೇಷನ್ ಅಂತೀವಿ. ಸೊ ತಂದೆ ತಾಯಿ ಆರ್ ಬೇರೆಯವರು ಕೊಟ್ಟಿದ್ದ ಮಾಹಿತಿ, ಪೇಷಂಟು ಅವನ ಬಗ್ಗೆ ಅವನೇ ಹೇಳಿದ ಮಾಹಿತಿ, ರೋಗದ ಬಗ್ಗೆ ಆ ಸಮಸ್ಯೆ ಬಗ್ಗೆ ವಿವರಗಳು ಪಡೆಯುವುದು, ಅದರ ಜೊತೆಗೆ ಆ ಸಂದರ್ಭದಲ್ಲಿ ಮಾನಸಿಕ ಸ್ಥಿತಿ ಅಧ್ಯಯನ ಮಾಡುವುದು, ಈ ಎಲ್ಲ ಅಂಶಗಳ ಆಧಾರದ ಮೇಲೆ we make a diagnosis. The diagnosis which we make generally will be tentative diagnosis. ಅಂದ್ರೆ ತಾತ್ಕಾಲಿಕವಾಗಿ ಒಂದು ರೋಗ ನಿರ್ಧಾರಣೆ ಮಾಡುವುದು. ಯಾಕಂದ್ರೆ ನಿರ್ಧಾರಣೆ ಬರುವಾಗ ಸ್ವಲ್ಪ ನಿಮಗೆ ಡೌಟ್ ಬಂದರೆ, ಕೆಲವು ಲಕ್ಷಣಗಳು ಒಂದು ಪರವಾಗಿದ್ದರೆ ಇನ್ನೊಂದು ಲಕ್ಷಣ ಬೇರೆ ರೀತಿಯಲ್ಲಿ ಇದ್ದರೆ ರೋಗ ನಿರ್ಧಾರಣೆ ಮಾಡುವ ಅವಕಾಶ ಇಲ್ಲ. ಅಂದ್ರೆ ಯು ಮೇಕ್ ಎ ಟೆಂಟೇಟಿವ್ ಡಯಾಗ್ನೋಸಿಸ್ and that you will review after some time, and then you make a diagnosis, final diagnosis. Diagnosis ಆದ ಮೇಲೆ you can give right line of treatment to him. This is history taking or psychiatric history taking ಅಂತೀವಿ. ಫಸ್ಟ್ ಟೈಮ್ ಪೇಷಂಟ್ ಬರುವಾಗ ಎ ಡೀಟೇಲ್ಡ್ ಹಿಸ್ಟ್ರಿ ವಿಲ್ ಬಿ ಟೇಕನ್, ಇನ್ಕ್ಲೂಡಿಂಗ್ ಮೆಂಟಲ್ ಸ್ಟ್ಯಾಟಸ್ ಎಕ್ಸಾಮಿನೇಷನ್. ಅದಾದ ಮೇಲೆ ಬರುವುದೆಲ್ಲ ನಾವು ಫಾಲೋ ಅಪ್ అని ಮಾಡಿಕೊಳ್ತೀವಿ. ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡುವುದು, ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಆಗಿದ್ದು ಎಲ್ಲ ನಾವು ಮಾಡ್ತೀವಿ. ಓಕೆ, Next one is treatment. ಏನು ಟ್ರೀಟ್ಮೆಂಟ್ ಜನರಲಿ ನಾವು ಕೊಡುವುದು, ಜನರಲಿ ನಾವು ಕೊಡುವುದು ಹಾಸ್ಪಿಟಲೈಸೇಷನ್ ಬೇಕಾ ಇಲ್ವಾ ಅನ್ನೋದು ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕು. Most of the mental disorders do not require hospitalization. ಎಷ್ಟೋ ಸಂದರ್ಭದಲ್ಲಿ ಹಾಸ್ಪಿಟಲೈಸೇಷನ್ ಬೇಕಾಗಿಲ್ಲ. ಹಾಸ್ಪಿಟಲೈಸೇಷನ್ ಈಸ್ ನಾಟ್ ಗುಡ್ ಫಾರ್ ದ ಪೇಷಂಟ್ ಆಲ್ಸೋ. ಅನಿವಾರ್ಯ ಆಗಿದ್ದರೆ, ಅವಶ್ಯಕತೆ ಇದ್ದರೆ ಮಾತ್ರ, ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಇಫ್ ದೇರ್ ಈಸ್ ಎ ಸೂಸೈಡಲ್ ಥ್ರೆಟ್, ಸೂಸೈಡಲ್ ರಿಸ್ಕ್ ಇದ್ರೆ ಆವಾಗ ಮಾತ್ರವೇ ನಾವು ಶಾರ್ಟ್ ಟರ್ಮ್ ಹಾಸ್ಪಿಟಲೈಸೇಷನ್ ಮಾಡ್ತೀವಿ. Or if the patient is very violent, very assaultive, abusive, destructive ಆಗಿರುವಾಗ ನಾವು ಕಂಟ್ರೋಲ್ ಮಾಡೋದಕ್ಕೆ ಆಗಿಲ್ಲ ಅಂದ್ರೆ ಆವಾಗ ಶಾರ್ಟ್ ಟರ್ಮ್ ಹಾಸ್ಪಿಟಲೈಸೇಷನ್ ಮಾಡ್ತೀವಿ. ಬಟ್ ನಾವು ವಾಟ್ ವಿ ಸೇ ಇಸ್ ಫ್ಯಾಮಿಲಿ ಕೇರ್ ಬೆಟರಾ, ಹಾಸ್ಪಿಟಲ್ ಕೇರ್ ಬೆಟರಾ ಅಂದ್ರೆ ಅನಿವಾರ್ಯ ಆದರೆ ಮಾತ್ರ you hospitalize him, otherwise treat him as an outpatient. That is always the best way of treatment. That means we don't require hospitalization in every case. Oh, okay, what type of treatment do you provide to the patients? We provide different type of treatment. The treatment depends upon the diagnosis. And there is one word which we use called as a prognosis. Prognosis means the chances of recovery from the problem. What are the positive points in the case? What are the negative points in the case? If the patient has a long duration of a problem, recovery will be difficult. If there is a cause for the problem, if there is a precipitating factor for the problem, recovery will be faster. If the patient comes from a very good family, harmonious family, recovery will be faster. If the problem starts all of a sudden, recovery will be faster. If the duration is kadame idre, recovery will be faster. If the premorbid personality was good prior to the onset of the illness, then the recovery will be good. So ivella navu prognosis navu madukondu recovery ಬಗ್ಗೆ ಹೇಳುವುದು. But treatment generally we give counseling, psychotherapy. Under psychotherapy we have behavior therapy, we have family therapy, we have marriage therapy, we have crisis intervention, we have different type of treatments are there. ಇದರ ಜೊತೆಗೆ drug management, drug medicines are also given. We have wonderful medicines. Medical medicines will definitely help the patients. So wherever required, medicines are prescribed. ಅದರ ಜೊತೆಗೆ we also use one more technique called as ECT, electroconvulsive therapy. This was started as early as 1938. It was started beginning. Andre 1938 ಅಲ್ಲಿ first time there were two experts, Serletti and Binney, first used ECT. But ಅವರು ಯೂಸ್ ಮಾಡುವಾಗ ಅದರ ಹೆಸರು ಬೇರೆ ಇಟ್ಟಿದ್ರು, EST, ಆಮೇಲೆ ECT ಆಗಿದೆ. ಈ ECT ಅಂದ್ರೆ ಎಲೆಕ್ಟ್ರಿಕ್ ಶಾಕ್ ಕೊಡುವುದು, ಲೋಕಲ್ ಲ್ಯಾಂಗ್ವೇಜ್ ಅಲ್ಲಿ ಗಿವಿಂಗ್ ಎಲೆಕ್ಟ್ರಿಕ್ ಶಾಕ್ ಟು ದ ಪೇಷಂಟ್. ಬಟ್ ಸರ್ಟನ್ ಕೇಸಸ್ ನಾವು ನೆಕ್ಸ್ಟ್ ಏನು ಅರ್ಥ ಮಾಡ್ಕೋಬೇಕು ಅಂದ್ರೆ ECT will be given only as a last resort only. Medicines will be the first choice. If medicines ಕೊಟ್ಟಿದ್ರೂ ಕಂಟ್ರೋಲ್ ಆಗಿಲ್ಲ ಅಂದ್ರೆ ಕೆಲವು ಕೇಸಸ್ಗೆ, ಎಸ್ಪೆಷಲಿ ಸಿವಿಯರ್ ಡಿಪ್ರೆಷನ್ ಇದ್ರೆ, ಆರ್ ಸಿವಿಯರ್ ಕ್ಯಾಟಟಾನಿಯಾ ಆರ್ ಸಿವಿಯರ್ ಸೈಕೋಸಿಸ್, ಡ್ರಗ್ಸ್ಗೆ ಏನೂ ರೆಸ್ಪಾಂಡ್ ಆಗಿಲ್ಲ ಅಂದ್ರೆ, ಕೆಲವು ಕೇಸಸ್ ಅಲ್ಲಿ ಮಾತ್ರವೇ ನಾವು ಡ್ರಗ್ ರೆಸ್ಪಾಂಡ್ ಆಗಿಲ್ಲ ಅಂದ್ರೆ ಆವಾಗ ಯೋಚನೆ ಮಾಡುವುದು ECT. ಸೊ ECT ದಲ್ಲಿ ಸ್ವಲ್ಪ ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್ ಆಲ್ಸೋ ವಿಲ್ ಬಿ ದೇರ್. ಮುಖ್ಯವಾದ ಸೈಡ್ ಎಫೆಕ್ಟ್ ಏನು ಅಂದ್ರೆ ಮೆಮೊರಿ ಡಿಸ್ಟರ್ಬೆನ್ಸ್. ಎಷ್ಟೋ ವಿಷಯಗಳು ಮರೆಯುವ ಅವಕಾಶ ಇದೆ. ಆರ್ ಕನ್ಫ್ಯೂಷನ್ ವಿಲ್ ಬಿ ದೇರ್ ಫಾರ್ ಸಮ್ ಟೈಮ್ ಆಫ್ಟರ್ ECT. ಆರ್ ಸಮಟೈಮ್ಸ್ ಹೆಡೇಕ್ ವಿಲ್ ಆಲ್ವೇಸ್ ಕಮ್ ಆಸ್ ಎ ಸೈಡ್ ಎಫೆಕ್ಟ್. ಬಟ್ ECT ಮುಖಾಂತರ ಬ್ರೈನ್ ಡ್ಯಾಮೇಜ್ ಏನೂ ಆಗುವುದಿಲ್ಲ ಅಂತ ನಾವು ತಿಳ್ಕೋಬೇಕು. ಬಟ್ ECT ಕೊಡುವಾಗ ಯೋಚನೆ ಮಾಡಿಕೊಡಬೇಕು. ಅನಿವಾರ್ಯ ಆದರೆ ಮಾತ್ರ ಕೊಡಬೇಕು. ಪೇಷಂಟ್ ಅಪ್ಪಣೆ ತಗೊಂಡೇ ಕೊಡಬೇಕು, ಪೇಷಂಟ್ ಆರ್ ರಿಲೇಟಿವ್. ಬಟ್ ECT ಕೊಡುವುದಕ್ಕೆ ಮುಂಚೆ ಸಂಪೂರ್ಣವಾದ ಎಕ್ಸಾಮಿನೇಷನ್ ಮಾಡಬೇಕು. ಫಿಸಿಕಲ್ ಎಕ್ಸಾಮಿನೇಷನ್, ಮೆಡಿಕಲ್ ಎಕ್ಸಾಮಿನೇಷನ್, ಸೈಕ್ಯಾಟ್ರಿಕ್ ಎಕ್ಸಾಮಿನೇಷನ್, ರುಟೀನ್ ಲ್ಯಾಬೊರೇಟರಿ ಟೆಸ್ಟ್ ಎಲ್ಲ ಮಾಡಿದ ಮೇಲೆ ಮಾತ್ರವೇ ಯು ಹ್ಯಾವ್ ಟು ಸೇ ವೆದರ್ ECT ಈಸ್ ಟು ಬಿ ಗಿವನ್. So ECT is the last choice and outgoing. It cannot be given as the first choice. Okay, next is mental health, mental illness, how it is defined in the law. That I will explain now. In the law, we have a law that is Mental Health Care Mental Health Care Act. No. Okay. Mental Health Care Act. We have a central legislation, Mental Health Care Act of 2017, that is implemented all over India. We have implemented in toto in Karnataka. In that, mental illness is defined like this. This definition, this is a legal definition. But I will come from the last one. Last one is, please see here, but does not include mental retardation, which is a condition of arrested or incomplete development of the mind of a person, especially characterized by subnormality of intelligence. The meaning is mental retardation or mental subnormality or intellectual disability does not come under mental illness. So this we have to say, mental retardation, ಬುದ್ಧಿಮಾನ್ಯತೆ ಅನ್ನುವುದು ಮಾನಸಿಕ ಕಾಯಿಲೆ ಅಡಿಯಲ್ಲಿ ಬರುವುದೇ ಇಲ್ಲ. ಯಾಕಂದ್ರೆ this is an incomplete development of the mind. It's not completely developed. Generally, it happens at the time of birth only or immediately afterwards. So mental retardation, we should not talk. Then what is mental illness? Mental illness means substantial. When I say substantial, means a very big and important disorder of thinking. ಯೋಚನೆ ಮಾಡುವುದಲ್ಲಿ ಸಮಸ್ಯೆ, thinking. Mood means happy or unhappy mood. Perception, just now I said hallucinations, grahike. Orientation, are you oriented to time, place, and person? Only three things. Orientation is it's a function of mind. Orientation means it's a function of the mind involving awareness of three dimensions. One is the time, place, and the person. Okay. Orientation or memory, again I say memory means recent memory, remote memory, and immediate memory. That grossly impairs means disturbance. Impairs what? Impairs judgment, behavior, capacity to realize or ability to meet ordinary demands of life. Ordinary demands of life you are not able to fulfill. But mental conditions associated with abuse of alcohol and drugs also come. Abusing alcohol, abusing drugs also come under the purview of mental illness. That's what we say, substance abuse also comes under mental illness. This is the legal definition of the term mental illness. Now let us see what are the causes of mental illness. Mental illnesses are caused by variety of factors. One is changes in the structure and functioning of the brain. If there is a brain fever, if there is a brain damage, if there is a brain injury, if there is prolonged intake of alcohol leading to brain damage, these are all the causes for mental disorders. Certain mental disorders come because of that. Hereditary factors, ವಂಶ ಪಾರಂಪರ್ಯವಾಗಿ ಬರುವುದು ಕೆಲವು ಅಂಶಗಳು. Certain mental health problems run in the families. Moonedu childhood experiences. If you come from a good family, an affectionate family, if you are taken care of well during childhood, there is no problem, he develops well. If there is a bad childhood experiences, then it may be a cause for the mental health problem. Home atmosphere, family atmosphere, other factors like bad peer group influence, unemployment, poverty, insecurity, exposure to stressful situations are all causes of mental disorders. Please understand, we do not know exactly the precise cause for mental disorders. We do not know precisely, but these are all possible causes for mental disorders. So the cause is not exactly known, but this is probability. Coming to psychiatry as a branch of medicine devoted to the treatment, to the study, treatment, and prevention of human behavior disturbances. That is a branch. The branch which deals with the human behavior problems or mental disorders is a psychiatry, a branch of medicine. Most of the specialties within the field of medicine deal primarily with the disturbances in the structure and functioning of individual organs or organ systems. Orthopedics deals with the bones. Neurosurgery deals with neurology deals with the nervous system. Certain branches deal with the ages. Pediatrics deals with the children's health. Geriatrics deals with the health of the aged persons. So pediatrics and geriatrics. Heart ki sambandha pattaddu, cardiology. So we have different systems of medicine on the basis of organ and organ systems. Every organ system is concerned with only one organ. For example, cardiology is concerned with the heart only. Nephrology deals with the kidney only. Like this. So we also, for example, just nephrology. Nephrology deals with the kidney, but there is one more branch called as psychiatry, which is concerned with the total individual. Psychiatry is concerned primarily with the functioning of the human organism as a unit. It refers to the behavior. The only branch of medicine which is concerned with the total individual is psychiatry. No other branch will be so exhaustive, so comprehensive like that of psychiatry. Just now I said pediatrics means children's problems only. Geriatrics means aged problem. Some are based on the system. For example, skin, dermatology, STDs. We have different things, some organs only. But only branch which is concerned with the total individual. His physical health, his social health, his psychological health, his cultural aspects, everything will be taken into consideration by psychiatry. Yakandre, human behavior is a function not only of biological, but also of psychological and social variables. Human behavior is not just a physiological variable. It is also a social variable, psychological variable. And hence, mental health professional must be familiar with both the biological and social sciences. Whoever is the mental health professionals, please understand, mental health professionals, according to our law, includes Ayush also. Ayush experts. Ayush experts means Ayurveda, Yoga and Naturopathy, Unani, Siddha, Homeopathy, along with the modern psychiatric doctors, all put together will be mental health professionals. Because they deal with mental health problem. Ayurveda also deals with mental health problems. Human behavior is a function of not only of biological, but also of psychological and social variables. And hence, mental health professionals must be familiar with both the biological and social sciences. A MD student in psychiatry will also study sociology. MD student in psychiatry will also study psychology. Will also study certain cultural aspects also. A social work student, MPhil level, he will also study psychology, he will also study psychiatry. A MPhil student in clinical psychology will also study psychiatry, will also study social work. That means all are important. Unless you are familiar with the biological issues and social issues, you will not be able to understand mental health problem clearly. So, for the clinical management of problem behavior, a number of mental health professionals have evolved. We have so many mental health professionals. Just now I said psychiatrist and also experts belonging to Ayush. Please understand, Ayush is a department of Ayush department is a department of central government. A refers to Ayurveda, Y refers to yoga and naturopathy, U refers to Unani, S refers to Siddha, and H refers to homeopathy. So they also are also called mental health professionals, along with a person who has done MD in psychiatry. He is also called as a mental health professional. We also have a team approach. That's what I said, a psychiatrist, a clinical psychologist, a psychiatric social worker, and a psychiatric nurse. Primarily, they work together. Who should be a psychiatrist? It is defined in the Act, Mental Health Care Act of 2017. What degree he should have? He should have either a diploma in psychological medicine, 2-year course after MBBS, or a 3-year MD course. The degree is recognized by Medical Council and also UGC. Then only he is called as a psychiatrist. Psychiatric social worker, he must have MSW qualification. In addition to that, 2-year MPhil full-time clinical program. And the degree is awarded by a university recognized by UGC. He is called as psychiatric social worker. A clinical psychologist, he must have a degree in PG in psychology and MPhil in clinical psychology recognized by Rehabilitation Council of India. He is called as clinical psychologist. A psychiatric nurse, BSc General Nursing plus 1-year psychiatric nursing from a recognized university called as psychiatric nurse. So qualification is prescribed. They are only eligible to become professionals. And we have a list of all professionals in India. All those who have the required qualification, we have a list of professionals. They are all recognized by the government to practice mental health care services. Okay, now let us see afterwards, Mental Health Care Act. There are different important aspects in the Mental Health Care Act. The first one is Central Mental Health Authority, a statutory body at the central level. And what is the work of this Central Mental Health Authority? This authority will register all mental health establishments in India. Mental health establishments means all hospitals which provide care to the patients. You have to have a list of all mental health care centers or mental health institution establishments in India. And to develop quality and service provision norms. How to maintain highest quality in these establishments? What should be the qualification of each professional? That also will be prescribed by that. To supervise all mental health establishments. Are they following the norms? Are they violating the human rights? This will be monitored by this committee. to maintain a national register of all professions, all professionals in India. A register will be maintained at central government level. To train all persons, including law enforcement officials and other professionals, about the provisions. We need to train all people, including the lawyers. And recently, I requested government to include the colleges and universities also, where this knowledge can be imparted. We have already organized a one-day program at Gadag Rural Development University, and we invited all medical professionals and all local professionals and students also to participate. It was a good program, partially funded by the government. Those who are interested, if you are interested, you can make use of this opportunity. To train all professionals, all persons, including law enforcement officials and police officials and other professionals, about the provisions. To advise the central government on all matters related to mental health services. This is the work of Central Mental Health Authority. And this authority is chaired by a secretary or additional secretary level of Health and Family Welfare Department at the central government level. We also have representatives, additional secretaries from other departments like Home Ministry and Women and Child Development, Social Welfare. They are also there. They are all ex officio members. When you say ex officio members, means these are all members by virtue of their position, not by name. They are not members by name. They are members by virtue of their position. Principal Secretary is a member. Whoever is the Principal Secretary will be a member. That's what we say, ex officio member. But something will be a surprise to you. This will also include non-official members also. Non-official members means members by name. So-and-so person only will be the member. You have one psychiatrist, you have mental health professionals also, one clinical psychologist, and one psychiatric nurse, all with 15 years of minimum experience in the field. All are recognized experts only in the field. They will be selected by the government and they will be on the committee for 3 years and they will advise the government periodically. And some more persons are there. We have 2 caregivers will be there. Caregivers means those who have stayed with the patient and taken care of him. He is called as a caretaker. ಮನೆಯಲ್ಲಿ patient ನೋಡಿಕೊಳ್ಳೋರು caretaker. The person may be a family member or the person may be an appointed person for this purpose only, some outsider. We also have 2 caregivers on the committee. We also have 2 patients. Patients who have had mental illness in the past, now completely recovered, they will also suggest. And we also have 2 NGOs representatives dealing with mental health issues will also be members. This is the committee at central government level, and the same committee, similar committee is there in every state. It is called a State Mental Health Authority, the second one. State Mental Health Authority, same functions. Mental Health Review Board will be there. This board is constituted for a district. In Karnataka, we have this review board. This board is chaired by a district judge or officer of state judicial services. He is the chairperson. And this review board deals with the violation of human rights. If there is a violation of human rights, this review board comes into the picture. Next is mental health establishment. This mental health establishment includes Ayurveda establishment, yoga, naturopathy, Unani, all homeopathy, everything will come in, including general hospital, including nursing homes also come under this. Every establishment must have a registration with the authority. That means every hospital in Karnataka must register with the State Mental Health Authority. Then only they can provide mental health services. Otherwise, it becomes illegal. Next is mental health professional. Who is mental health professional? I have already explained to you. That is a psychiatrist or Ayush representatives. Then we have psychiatrist, psychiatric social worker, clinical psychologist, mental health nurse. This is mentioned in the act. Okay, the last part of it is, ಸ್ವಲ್ಪ fast ಆಗಿ ಹೋಗ್ತೀನಿ. These are all the rights of people. ನಮ್ಮ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಕೇರ್ ಆಕ್ಟ್ ಅಲ್ಲಿ ಲೆಜಿಸ್ಲೇಷನ್ ದಲ್ಲಿ ಹೃದಯ ಭಾಗ, the heart of the legislation is the protection, promotion and fulfillment of the rights of the persons with mental illness during the delivery of mental health care and services. We have to safeguard the rights of the patients. What are the rights they have? The first one is right to access mental health care. Right to access mental health care and treatment from mental health services run by or funded by government. This is the first right. Every patient has the right to access mental health care, including medicines also. Including medicine should be available very close to his house, geographically accessible. In terms of money, it should be accessible, quality accessible. The second right is every patient has the right to live with the community. Every patient has the right to live within the community and not to be segregated from the society. You cannot force him to live somewhere else. To live with his family, if the family is available, allow the patient to live with the family. Don't take him to the hospital and put him inside the hospital forcibly. Third one is right to protection from cruel, inhuman, and degrading treatment. That is to live in a very safe place. All patients have the right to live in a safe and hygienic environment. Hygienic environment of the hospital or mental health establishment. The fourth one is right to equality and non-discrimination. Person with mental illness shall be treated as equal to a person with physical illness. Andre, ಬೇರೆ ಶಾರೀರಿಕ ಕಾಯಿಲೆ ಇರುವ ಪೇಷಂಟ್ಗೆ ನಾವು ಏ ರೀತಿಯಲ್ಲಿ ಆದ್ಯತೆ ಕೊಡ್ತೀವೋ ಅದೇ ರೀತಿಯಲ್ಲಿ ಆದ್ಯತೆ ಮೆಂಟಲಿ ಇಲ್ಲವರಿಗೆ ಕೊಡಬೇಕು. You have to treat him on par with the patients of other medical problems. Person with mental illness shall be treated as equal to a person with physical illness in the provision of healthcare services, especially ambulance. When you provide ambulance to other medical problem, you have to provide ambulance to this problem also. Fifth one is right to information. Patient has the right to get details of his illness. ಅವನ ಕಾಯಿಲೆ ಬಗ್ಗೆ ತಿಳ್ಕೊಳ್ಳುವ ಹಕ್ಕು ಅವರಿಗಿದೆ. I want to know about my illness. What treatment you are proposing, the side effects of the treatment. I have the right to know everything. You have to furnish all the details in the language known to me. Nanna ಭಾಷೆಯಲ್ಲಿ ನೀವು ಕೊಡಿ ಸ್ವಾಮಿ. This is right to information. Next is right to confidentiality. Patient has the right to confidentiality in respect of patient's mental health care, mental health treatment, and physical health care, everything. You should not disclose any of my information. Make it confidential. Okay, seventh one is restriction of release of information in respect of mental illness. No photographs or any other information relating to a person with mental illness undergoing treatment at a mental health establishment shall be released to media. My photograph in the hospital should not be released to media. That is another right. The next right is right to access medical records. All persons with mental illness shall have the right to access their medical records. I want to know what you have written in my medical record. I can have access to that, my own record. Only thing is, in certain exceptional cases, some information can be concealed for the safety of the patient. Okay, but adre ella patients ki ಅವರ ರೆಕಾರ್ಡ್ ತಗೊಂಡು ಡಾಕ್ಟರ್ ಅವರ ಬಗ್ಗೆ ಏನು ಬರೆದಿದ್ರು ಅನ್ನೋ ತಿಳ್ಕೊಳ್ಳುವ ಅಧಿಕಾರ ಅವರಿಗಿದೆ. Next one is right to personal contacts and communication. That means if anybody wants to see me in the hospital, I can say no. I don't want to see anyone. I don't want to attend any phone calls. I don't want to answer any letter. I have the right to say no. If I like the person, I can contact. If I don't like, I can say no. But for certain cases, some persons, patient cannot say no. For example, if there is a judge comes to see the patient, he cannot say no. Judge bandre, yes anbeko. Or any member of state mental health authority bandre official lagi, he cannot say no to that one. Okay, a treatment kodo psychiatrist bandre, he cannot say no to those people. Andre bere sandarbhadalli, if I don't want to see a person, I can say yes, I don't want to see you. Next one is right to legal aid. A person with mental illness shall be entitled to receive free legal services to exercise any of his rights. ನನ್ನ ಹಕ್ಕುಗಳು ಕಾಪಾಡಬೇಕು. If there is any violation of human right, I can represent this matter, for which I can get free legal aid also. The last one is any person with the mental illness or his nominated person also, or whoever his name is nominated, can also give a complaint regarding deficiencies in the provision of care, treatment, and services in mental health establishment. If you don't take care of me properly, I can give a complaint. Based on the complaint, inquiry will be there, and there is a possibility of punishment to the person also. Okay, friends, the last concluding part is there any way forward to provide best mental health care to people? There are certain things. What are they? Provide treatment in primary health care. That's what we say, primary care. Don't think of providing mental health care in the hospitals only. I said earlier, only 10% of patients are receiving mental health care, but 90% of the patients who are supposed to get mental health care, they are living in the community only. They don't have anyone to support them. They become chronic for a period of time. What to do? The solution is community mental health programs. This is alternate. Community mental health care means providing care to people in the community. Care in the community and care by the community, both put together, is called as community mental health care. Care in the community and care by the community. Instead of asking the person to come to your hospital, why don't you go to them? Go to their place. Provide services to them. You can provide preventive services also, therapeutic services also, development services also. The services, the scope of services will be much better if you go to community. So community mental health care has all advantages. Any advantage? ಮೊದಲನೆಯದು ಕಡಿಮೆ ಖರ್ಚು. Hospital ನಿರ್ವಹಣೆ ಮಾಡಬೇಕಂದ್ರೆ you require crores of rupees. If you provide care in the hospital with limited expenditure, you can provide comprehensive health care. ಕಡಿಮೆ ಖರ್ಚು, ಜಾಸ್ತಿ ಸೇವೆಗಳು, community mental health care. Second thing is you can get the acceptance from the community. When people accept you, then your job will become very, very simple. So make it people's program. Don't think it is something else. It is a part of their program where you involve people also in the treatment. So it becomes a people's program. That will be very much successful. So provide treatment in the primary health care, provide care in the community, educate the public also, involve the communities, families, and consumers, and develop human resources linked with other sectors. Mental health services cannot be provided independently in the community. You have to work with education department. You have to work with agriculture department. You have to work with other departments, for example, agriculture, social welfare. That means we require a coordination of different sectors, sectoral coordination. We want different mental health to be part of general health. So then only it will be very successful. The next one is monitor community mental health programs periodically, how successful they are. We have a national mental health policy. We have a national mental health program. ನಮಗೆ ಒಂದು ಪ್ರೋಗ್ರಾಮ್ ಒಂದಿದೆ, ನ್ಯಾಷನಲ್ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಪ್ರೋಗ್ರಾಮ್. ಏನು ನಾವು ಕೆಲಸ ಮಾಡುವುದೇನು ಅಂದರೆ we provide care to people living in every village, from district to periphery. Periphery andre jilla last village varaku. We go in a mobile van, we go to different places, we provide care to people in the community only, from district to village. Second approach is from village to district also. If there is a mental health problem in a village, what they should do? The first place is they should go to a primary health center. If primary health center is not able to manage the problem, then refer the case to district health center. District health center, you have all the facilities. So one is from district, you go to village. Second is from village, you have another approach also. We have a wonderful policy in India, mental health policy. We have a mental health program also in India. It has become a model to other countries also. And community mental health programs, very, very, very effective, cost effective. When I say cost effective, means you can avoid unnecessary hospitalization. You can have multidisciplinary or team approach. Emphasis can be on development, prevention, and treatment also. It will be very close to people. People's cooperation you can obtain. Your programs will be very, very successful. You don't require so much of budget. Only thing is you reach people, you go to them wherever they are. For people also advantages are, they need not go to city for getting the service. People are coming to their doorstep. They can involve themselves in their routine work. Agriculture work will not be disturbed. So for people it is good. For you also it is good. And the scope will also be very wide. And it is found to be cost effective now and proved to be very successful. And especially for countries like India, we need to concentrate more on community mental health programs. Go to people and don't ask people to come to you. ನಾವು ಅವರ ಹತ್ರ ಹೋಗಬೇಕು, ಅವರು ನಮ್ಮ ಹತ್ರ ಬರುವುದು ಬದಲಾಗಿ. Best thing would be reach the unreached. ಯಾರನ್ನು ನಾವು ತಲುಪೋದಕ್ಕೆ ಆಗೋದಿಲ್ವೋ ಅವರ ಹತ್ರ ಹೋಗುವುದು ಯಾವಾಗ ಬೆಟರ್. Okay, friends, that's the end of last one slide is there. Mental health care includes analysis, diagnosis, person's mental health, diagnosis of mental health condition, treatment, as well as care and rehabilitation of such persons for his mental illness or suspected mental illness. Mental health care does not mean only just giving treatment. It also includes promotion of mental health, prevention of mental illness also. That's what I said. Community mental health care alli ನಾವು ಎಲ್ಲಾ ವಿಷಯಗಳ ಬಗ್ಗೆ ಗಮನ ಇಡಬಹುದು. So community mental health program is the hope of our country to provide best mental health care to people. Thank you. Abhi, you can ask me now.
Sir, Dr. Shivkumar sir, he has asked, what is mob psychology? Is it like he has given an explanation saying that purchasing gold during the Akshaya Tritiya will make them richer and richer? Is this mob psychology? Am I right?
You tell me, what do you say? This is the consumer's behavior. When something cheap is there, when something is available at a cheaper rate, naturally we run towards that. This is the general behavior of an individual. See, we say Akshaya Tritiya, that is the day where people go to buy gold. That is the sentiment, psychology of our own people. But don't say good or bad.
Okay, sir.
Yes, sir. Any questions?
Sir, one question, sir.
Kill, sir. Yes, sir.
Sir, is it really stress leads to the mental disability? Stress.
It all depends upon the amount of stress. Now, I said stressor. Your reaction to the stressor. Your reaction to the stressor is called stress.
Yeah. Yes, sir.
All will
okay,
not,
how to overcome this, sir?
all will not react in the same manner. Some are very, very sensitive. Their reaction will be different. Some are very stubborn. Their reaction will be different. When somebody is failed in the examination, tell him that this is not the only thing in life. And there are so many great people are there who are failed in the examination only. And we don't like people getting 35 marks and then pass the examination. Tomorrow you appear for the examination, I'm sure that you will get 80 marks. That is better. So your failure should be a foundation for the future. Atara neevu helidre, a person will come out of the depression, whatever he has. But again, I say stress up to an optimum level is good. Too much of stress is a problem, and too little stress also is a problem. Too much of stress leads to frustration, and too little stress will lead to boredom. That is also there. We need an optimum level of stress. Now, what is optimum? That depends upon the perception of the person. If I take it very, very seriously, my reaction will be different. If I don't bother about that one, my reaction will be different. The stress or not having stress all depends upon your perception only.
Sir, ಈ ತರ ಇದ್ದಾಗ ಕೋಪಿಂಗ್ ಸ್ಟ್ರಾಟಜಿ ಏನ್ ಮಾಡ್ತೀರಿ ಸರ್?
Coping strategy?
ಯಾವ ತರ ಕೋಪಿಂಗ್ ಸ್ಟ್ರಾಟಜಿ ಅಡಾಪ್ಟ್ ಮಾಡ್ಕೋಬೇಕು ಸರ್ ಸ್ಟ್ರೆಸ್ ಇದ್ದಾಗ?
I have just given failure in the examination is stress.
Okay.
You just tell him, educate him and motivate him. I think it will definitely work out.
Okay, sir.
It will definitely work out. Next, sir.
ಸರ್ ನಮಸ್ಕಾರ.
ನಮಸ್ಕಾರ.
ಇದ್ರ ಗದಗಲ್ಲಿ ಸೆಂಟ್ರಲ್ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಕೇರ್ ರಿಲೇಟೆಡ್ ಆಗಿ ಒಂದು ವರ್ಕ್ಶಾಪ್ ನಡೀತು. ಇದನ್ನ ಸದುಪಯೋಗ ಪಡ್ಕೊಳ್ಳಿ ಅಂತ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಮಾತಾಡಿದ್ವಿ. ಒಂಚೂರು ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಿ ಸರ್ ಅದನ್ನ ಇನ್ನೊಂದ್ಸರಿ.
ಸರ್, ನಾವು ಮಾಡಿದ್ದು, ನಾನು ಎಷ್ಟೋ ಮೀಟಿಂಗ್ಸ್ ಅಲ್ಲಿ ಮುಂಚೆಯಿಂದ, I am a member of the Karnataka State Mental Health Authority. I have just now mentioned at central level, you have the principal secretary there. At state level also, we have a program. ಇಲ್ಲಿ ನಾನು ಏನು ಹೇಳ್ತೀನಿ ಅಂದ್ರೆ, ಈಗ